to invite Ms. Bridget from UNE to present the reflection study.
Good morning, everybody. Is that too loud or is that too loud? Fine. Okay. Alright, so good morning. My name is Brighid Carey and I'm in my 4th and final year of a Bachelor of Pharmacy with honours at UNE, and I'm one of the 7 pharmacy students on this study tour. Of our group, as was mentioned, none of us have ever been to Sri Lanka before. And you have a beautiful country with a beautiful landscape, and we've loved experiencing the spicy food, the cricket and the wildlife, especially the elephants and the monkeys. Everyone we've come across has been so welcoming and shown great hospitality towards us, as we've seen this morning. The hospital staff, or the facility staff in particular, happily took time out of their days to accommodate us, taking us, talking with us and showing us around each facility, for which we are very grateful. From our experience, it's evident that you are very proud of the healthcare services that you provide. We've seen a real passion and enthusiasm for the future development of your healthcare system and a determination to make it better for the Sri Lankan people, but also for the healthcare workers. I see it as a real compliment that inspiration is being taken from the Australian system. Of course, every model has its problems, and it was interesting to see that the private sector is facing some of the problems that we see at home, including the increasing expectations of patients for services to be provided in a very timely manner, and requests for certain treatments like antibiotics when they may not be clinically necessary. However, we are impressed that Sri Lankan healthcare is widely available free of charge. We were explicitly told that a patient is never turned away, which really reflects the nature of the Sri Lankan people that we've experienced. Here, healthcare workers appear to be very dedicated to their roles. It impressed upon us that although a part of their jobs, midwives make home visits within the first 5 days after a child is born. We were also impressed by the immunisation schedule for children, and this is a very topical issue in Australia at the moment, as vaccinations for children are not compulsory, but the federal government has announced a policy to stop welfare payments or government payments to parents who don't vaccinate their children. And also, pharmacists have recently been allowed to become vaccinators. We also found that great care is invested into efficiently maintaining and utilising supplies so that there is very little waste. With medication, this is avoiding improper storage and expiry, and we have great respect for this. As in Australia, we face major barriers to adequate cold chain storage, especially in rural and remote areas, and expiry is often overlooked. Unfortunately, this is possibly due to more readily available funding and supply. While this has given us a great healthcare service, it does very well with what it has. To move more specifically to pharmacy, we were so surprised to discover the huge workload of the pharmacists, in that they're responsible for the control of both drug and non-drug supplies in the hospital. Our appreciation grew for their role when we also found out that supply orders may need to be made 12 to 24 months in advance. And in Australia, we can usually order for supply the following day. We also noticed that pharmacists often work without assistants to help dispense, dispense prescriptions like we would see in Australia, considering that there are hundreds processed each day. What made this more surprising was that we saw so few computers, because we do rely on them so heavily for dispensing and stock control. Now, while technology has been introduced at Trincomalee, for example, we've seen that it's eased the pressure on pharmacists and made their work easier. But at other facilities, such as Lady Ridgeway, they still manage very well thanks to their efficiency and organisation, as Anna Marie was talking about. But this makes me wonder whether we rely too heavily or too much on technology at home. We were pleased to see an apparent push, particularly at a Siri Central Hospital, for the pharmacists to be more involved with patient care, particularly with disease and medication counselling. And by counselling, I mean to actively educate and give guidance to individual patients. From first year, or at home from first year, our lecturers have emphasised the importance of physically and actively interacting with patients, dispensing an excuse me, can I have some water? So sorry. Just one moment. Thank you. Excuse me. So dispensing and supplying a prescription is much more than just how many tablets and when to take them. We have to consider lots of other aspects, including dose, drug interactions and adverse reactions. We find this particularly relevant as with Australia, and as has just been talked about, two of the major health concerns in this country are diabetes and heart disease. Alongside medication, there is so much that can be done in lifestyle-wise to improve management, prevent progression and reduce risk for patients with these conditions. And pharmacists are very well capable of helping with this by also collaborating collaborating with other health professionals. Similarly, we were pleased to see active health promotion activities, such as the prenatal education sessions at the Maternal and Child Health Centre and the Nutrition Society Good Food Festival, where we participated in the cycling race. These activities provide an opportunity for both Sri Lankan and Australian pharmacists in the community or retail pharmacies to move outside of the dispensary and interact more with patients, other than just those with prescriptions. This is how we see pharmacy, interprofessional collaboration and global health continuing to develop in the future. Coming to Sri Lanka for our practicum has given us a unique opportunity to reflect on the way we want to practice as pharmacists in the future and how we can contribute to the healthcare system. We really thank you for welcoming us to your country and sharing this experience with us. And we hope that UNE will be able to provide your students with the same hospitality that you have shown us on their move to study in Australia. Thank you.